Sudden cardiac arrest affects the lives of approximately 356,000 people per year across the United States. It does not discriminate. Sudden cardiac arrest affects people of all ages, even children. We offer pediatric pads for all Defibtech AEDs, which can be used when treating someone under 8 years or less than 55 pounds. All of our AED pads have pictures on them showing the user exactly where to place them. For the sake of this demonstration, we will be using our AED trainer and training pads. The only visual difference between the appearance of our trainer and standard AED is the red sides. Our clinical use AEDs have black sides. It is important to remember, do not delay therapy to determine exact age or weight. As you can see, on our adult pads, there is a picture showing one pad placed on the top right side of the patient's chest under the collarbone. The other pad shows a picture on the left side of the rib cage under the armpit. Now let's look at pediatric pads. As you can see, they are smaller than the adult pads. It is important that when the pads are placed on the chest, they never touch each other. You can also see the placement of the pads is different. When using pediatric pads, one is placed in the center of the chest and the other is placed in the center of the back between the shoulder blades. We suggest storing a set of pediatric pads in the AED case or cabinet at all times so they can be used if needed. Remember, do not delay treatment while trying to determine age or weight. If pediatric pads are not available, apply adult pads in the appropriate location for a child or infant and use the AED. When someone suffers sudden cardiac arrest, the quicker an AED is used, the higher the chances are for survival.